Curioso, and welcome back to the Welsh History Podcast, episode 223, Dark Shadows in Increasing Light. The 1840s were a pivotal time in Welsh history. As we've mentioned in the last few episodes, the Industrial Revolution was in full swing, bringing rapid urbanization and significant changes to daily life. But with the progress came new health challenges, something that was, of course, starting to happen because people were moving closer and closer together. Instead of your neighbor being a few miles down the road, they were now right up against you. And it wasn't just them, it was their entire family and possibly extended family all living in a small little home instead of a easier to digest and stay away from, if they were ill, farm area. This, of course, starts to become an issue. And in this episode, we're going to basically paint a picture of what health and medical services you could look forward to in Wales in this period. In the 1840s, Wales faced a range of public health issues. The rapid growth of towns and cities led to overcrowded living conditions, inadequate sanitation, and frequent outbreaks of disease such as cholera, for instance. And these, of course, were major concerns. Obviously, this is something that's been happening before, but now with these larger towns and cities that are growing up, disease is spreading in much more rapid frequency, and because of contamination in the water, it wreaked havoc on these communities. Imagine bustling streets with no proper sewage systems where waste was often dumped in open drains. This environment was a breeding ground for cholera and other waterborne diseases. In 1849, a cholera outbreak in Cardiff and other parts of Wales highlighted the urgent need for improved sanitation. The effect of these diseases was devastating. Mortality rates were high, and the lack of understanding about disease transmission meant that the responses were often inadequate. Keep in mind that even though science is developing at this time period, most of the advances in science were being led without a full understanding of what was causing things. The idea of microbiology was not really a thing. We were only starting to get to grips around how diseases were caused, and so there wasn't real solutions yet for a lot of this stuff. So people were left to their own devices in ways that were very similar to what had happened 1,000 years ago, in effect. It wasn't until later in the century that the true connection between sanitation and health would actually become clear. So, what was a doctor or a medical professional at this time? The medical field in the 1840s was far from the advanced sciences we know about today and understand. Most doctors were trained through apprenticeships or medical schools that lacked standardization, and education could be a bit sketchy. Medical training was evolving, but it was still rudimentary by modern standards. Surgeons and doctors relied heavily on traditional practices and herbal remedies. Anesthesia was just beginning to be used, with ether and chloroform starting to make their way into surgeries. However, not all medical care was provided by formally trained professionals, as you can imagine. Many Welsh communities relied on local healers, herbalists, and homeopaths, and these practitioners often filled the gaps left by formal medical establishments, especially in rural areas. Think of how the development of childbirth functioned previously. It would, of course, do a 180 in this time period, but at that time, typically it was being done with local people and maybe one person who actually understood. Maybe they were just a mother that had a few kids, or maybe they were an actual midwife who knew more about the procedure, trying to help birth children still incredibly in a dangerous environment. Hospitals in Victorian Wales were quite different from what we consider today's institutions to be. Most hospitals were charitable organizations or workhouse infirmaries, where they were often overcrowded and under-resourced. Maybe that is a little bit more modern, let's be honest. For example, the Cardiff Infirmary, founded in 1830, struggled with the demand for care. Conditions were basic, and the focus was often on treating the most urgent cases rather than providing what would be considered comprehensive care. This lack of resource meant that many patients didn't receive the care that they needed. Despite these challenges, there were efforts to improve healthcare. Public health reforms and increasing awareness about sanitation and disease were beginning to make a difference in laying the groundwork for further advancements and the more modern health system. So, what can we take away from the state of health in the 1840s in Wales? The challenges of that era, from disease outbreaks and inadequate health facilities, shaped the development of modern medicine and public health. Understanding this history helps us to appreciate the progress that, of course, has been made and the ongoing efforts to improve health for all. Of course, this was still a transformative period for medicine. A lot of advancements were being made and changes were coming. However, the profession was still in its formative years and the role of doctors in Wales was evolving. So, we're going to examine how doctors were trained and what their professional lives looked like. In the early Victorian era, becoming a doctor was not a standardized thing as it is today. As I mentioned earlier, most of the doctors in Wales were trained through apprenticeships rather than formal medical schools. These apprenticeships were often informal, and young men, because they typically were learning from established practitioners. So very similar to a modern apprenticeship. Medical education was gradually becoming more structured and more formalized. But if you look in the past history of medical work, a lot of the down and dirty dealing with actual patients was generally done by people who weren't trained. And those that were trained were typically in academic areas and weren't dealing with a lot of this. This was starting to change now. But that was kind of the problem that they had. There was kind of this diversion between the two, which created sort of these issues. And there were a few medical schools and institutions now in the UK, though, as you'd imagine, not all had high standards. For example, the University of Edinburgh was a leading institution, but many Welsh doctors trained in London or went abroad. In addition to these apprenticeships, formal education that was given, some doctors gained their qualifications through examinations, testing. The Medical Act of 1858 would eventually introduce the General Medical Council, which would regulate and standardize medical training. But in the 1840s, doctors were still largely self-regulated. In other words, your entire determination about whether you were a doctor was determined by, the person you were apprenticing under, or possibly just a doctor who kind of said, yeah, you sort of know what you're doing. As you can imagine, medical practice in Victorian Wales was quite different from what we see today, and doctors had limited access to modern diagnostic tools and treatment. They relied heavily on observation, rudimentary diagnostic methods, and traditional remedies. Understanding of circulation of blood, understanding about how bones work, and all of those larger things were starting at this point to be understood. But even now, it's just slowly filtering out. I mean, don't get me wrong, there were people that understood at least some of these things, but a lot of it only started to be fully understood in these decades. Militaries, of course, had doctors that actually understood a lot more than like your average medical home doctor would do, simply because they had to deal with things in ways that were very different. I mean, they were dealing with wounds and healthy people who were injured and having to fix that rather than dealing with people who are either so sick that they're, could die, or dead people who things didn't function the same with a dead person as they do with a live person. So you have kind of different ways of looking at things. There's people, like when they talk about, for example, the school in Edinburgh, they were doing things like starting to work with cadavers to figure out how circulation's working. There was various things that they were doing to try and educate themselves on how humans worked. You got to remember, in the medieval period, they used to think that things were dealt with by humors, and that basically you had these 4 humors within the body that dictated everything that created you. And it was still largely based around this kind of idea for many, many years. And it's only now that that starts to change and you start to rid yourself of this kind of thinking and start to move towards a better understanding of all these things. But this is something that we sort of see developing at this point. One of the key challenges, of course, is the lack of anesthesia. So in other words, surgeons are performing operations with only, at best, local anesthetics, or in many cases with none at all. So bite on a stick, have a whiskey, anything that would sort of dull the pain was the best they could do. This made surgery particularly a grueling experience for patients and very dangerous, because if a patient's having a procedure done while they're awake or while they're in pain, their body fights against this and their mind will fight against this. So as you can imagine, it makes it even more dangerous. There are things like chloroform and ether that are coming on board and being used, but these are only developing in a slow amount, and it's not like there's loads of it yet. Doctors also have to contend with the limitations of their medical knowledge. Germ theory, as I mentioned earlier, was not established, so an understanding of disease transmission and hygiene was basically rudimentary. Many doctors and medical professionals still believed in the idea of miasma, which posited that diseases were caused by bad air. That's where we get the terms for malaria, for example. The idea that it's the air around us that creates it. Now, this is ironic when you consider things like COVID, where it is passed through the air, but other diseases are not passed that way, and we didn't understand that. We just thought that, if you have a bad smell, that's a disease being passed to you. And, how would they know if they didn't have the ability to figure this out? In addition to formally trained doctors, Wales had a rich tradition of alternative practitioners. Herbalists, homeopaths, and other non-traditional healers played a significant role in local healthcare. And quite often, that's all you saw if you lived in rural areas. You didn't see a doctor by any means. These practices often provided care in, as I said, rural areas where the access to trained doctors was limited. They used herbal remedies, folk medicine, and various traditional practices to treat ailments. We kind of know about this nowadays, but then it was much more common and much more frequent. While some of these methods were based on long-standing traditions and had some basis in actual practicality, others were based on empirical knowledge, which was passed down. Some of it was based on, can I gain a bit of bucks off of you? Or pounds, I guess I should say more correctly. So they weren't always accurate or trustworthy. Relationships between conventional doctors and alternate practitioners was sometimes strained, much like today. Many doctors view these healers with skepticism, much like today, while patients often preferred familiar remedies and personal care that these local practitioners could actually give them, unlike the doctors. The early efforts of these medical professionals, combined with emerging public health reforms and scientific discoveries, set the stage for the modernization of medicine. And the experience and struggles of these Victorian doctors helped shape the standards and practices which now exist. Of course, in this episode, we mentioned a little bit about hospitals and the way they work, but I want to go into a bit further detail. Many of the hospitals that existed in this time period were, as I said, charitable institutions run by local communities and religious organizations. In fact, the idea of a hospital initially came out of religious movements who had hospitals, which were more like hotels than they were what we would consider a hospital today, but became hospitals because people would come to them when they were ill and sick or injured, and a lot of the clerics were capable of at least supporting them and willing, unlike a lot of other people who may not have been. And we talked a lot in the past about how that was like a social safety net for people. Well, that ideal kind of comes into a modern concept here. These, however, were overcrowded. They were largely designated to treat acute illness and injury rather than long-term care, and facilities were often sparse with limited medical equipment and no standard practice, as you can imagine. The hospitals of this time were also heavily reliant on donations and voluntary contributions in order to continue to function. The lack of government funding meant that resources were often stretched thin, and hospitals struggled to keep up with the increasing demand for medical care. As you can imagine, people in rural areas were not going to hospitals. It was people in towns and in cities that were actually flocking to them because they didn't have the local practitioner that they grew up with living in the area that they could go to. And so hospitals become an important part of communal function. Unfortunately, at a time when hospitals were not really able to deal with this, these healthcare facilities faced numerous challenges. One of the most pressing issues was sanitation. Hospitals often lacked proper sewage systems and clean water supplies, which contributed to the spread of infections, as you can imagine, so going to a hospital was a risk. Infectious diseases like typhoid and cholera were common, and the understanding of germ theory still in its infancy, so people didn't even necessarily understand that. And as a result, hospitals struggled with high rates of hospital-acquired infections and poor patient outcomes. Another challenge was the shortage of trained medical professionals. Many hospitals operated with limited personnel, and the lack of formal medical training for many doctors and nurses meant that standards, of course, as I mentioned before, varied wildly. Despite these challenges, they did see some important innovations and improvements in these healthcare facilities. One of the significant developments was the beginning of the efforts to improve hospital hygiene and sanitation. Public health reformers and pioneering doctors began to recognize the link between cleanliness and health outcomes. This led to efforts to improve hospital cleanliness, such as better waste disposal practices and the use of antiseptics to help deal with germ spread. Additionally, there were gradual improvements in hospital design. Some new hospitals were actually built with better ventilation, more space, reflecting a growing understanding of the importance of a healthy environment for patient care. Public health reforms played a crucial role in shaping the future of hospitals and healthcare facilities. The Public Health Act of 1848, for example, marked a significant move towards a more organized public health and public health measures. This act aimed to address sanitation issues and improve local conditions in the cities and towns. While it initially focused on more general public health rather than hospitals specifically, its principles laid the groundwork for future improvements in medical facilities. The impact of these reforms was a gradual one, but it did set the stage for more comprehensive changes in healthcare, and by the end of the 19th century, hospitals would see significant advancement in medical technology, hygiene practices, and patient care. The evolution of hospitals in Victorian Wales was critical to the broader development of modern healthcare. The challenges and innovations of the 1840s helped shape the future of the medical institution and laid the foundations for what advances would follow. As you can imagine, in this period, shock and surprise, most of the access to healthcare was not evenly distributed. The social economic divide played a significant role in determining who received medical care and the quality of that care. In 1840s, the access to medical care in Wales was heavily influenced by social class. For the wealthy, medical care was often of a higher standard. Wealthy individuals could afford a private doctor who provided more personalized and often more effective care. Private doctors often were better trained and had access to more resources. They could offer more advanced treatments and had the advantage of being able to visit their patients in person in the comfort of their homes, as opposed to dragging them to what we just discussed was unsafe conditions. In contrast, the poor had limited access to quality medical care. Many relied on public hospitals or the infirmaries, as we mentioned, and of course these were overcrowded and underfunded and kind of, in a way, a death trap. The Industrial Revolution had a profound impact on healthcare in Wales, and the rapid industrialization led to significant urban growth, but also created health challenges, particularly for the working classes. The harsh working environment led to a range of other health problems, from respiratory issues to all sorts of injuries. Combined with this, now you have the rising use of coal fires to heat homes and to cook food and do all of those things, which also are spewing stuff in the air with no management of it and no consideration of the consequence of it. Think of how that would affect your lungs and your breathing, and how often it would create these disgusting fogs that were pollution fogs in places like London or any major center where you're going to have so much spewing out of all locations, from the industry to the church to the hospital to the home, all spewing coal smoke into the air. It's not a healthy environment. Just saying. And despite all of these challenges, industrialization, of course, did bring improvements. For example, the establishment of the Factory Act in 1833 set a precedent for worker welfare and introduced provisions for health and safety, which would slowly influence broader healthcare reforms and, of course, influence health and safety measures that would come into the workplace over time. Healthcare access also varied significantly between the rural and urban areas. In cities like Cardiff and Swansea, there were more hospitals and more medical practitioners, but these facilities were often overwhelmed and struggled to meet the needs of the growing population. In the rural areas, by contrast, access to healthcare was much more limited. Many communities, of course, relied on their local healer, but also some would travel long distances to reach a nearest hospital or doctor. This disparity, of course, often meant that rural inhabitants received less timely and less efficient care, and less effective care. The government and charitable organizations began to play a role in healthcare during this period. Poor Law Amendment Act of 1834 was significant in shaping how healthcare was provided to the poor. We've mentioned a bit about this in the past and about how that law aimed to standardize poor relief, including medical care, but it often led to harsh conditions in workhouses. Infirmaries developed for workhouses are one of the examples of their healthcare methodology, and over time, there were efforts to improve conditions and provide more comprehensive care. This, of course, meant that various forms of treatment and ways of funding hospitals were starting to grow, and the government was getting more and more involved. Nonetheless, still highlighted the significant disparities in access to healthcare, with the wealthy enjoying what amounts to better and more frequent care than their poorer fellow citizens. These disparities, of course, influenced the development of future health reforms and policies and the way they were funded. The lessons learned from this period led to gradual improvements in health access and equity, and by the end of the 19th century and into the 20th century, there would be significant advancements in public health policies and the establishment of more comprehensive systems, better standardization, better training and education, and a better understanding of all the things that create and develop disease. And all of these things become important because they allow us to understand and create better health outcomes. And even today, even though we look and we say our health outcomes are not ideal, and there's lots of discussion about it, no matter what country you live in, the reality of it is, by comparison to this period, we are massive steps ahead, and we are lucky to have so much of this developed. Does it need maintained? Does it need more money? Does it need more funding? Is it important to have more education? Sure, all of that is the truth. But by comparison to where we are in a better state, and it is a better situation. So with that, I'd like to thank you for listening today. If you have any questions, comments, or concerns, you can always reach me at the Welsh History Podcast at gmail.com, or on Twitter/X at Welsh History Pod, or on Facebook at facebook.com/Welsh History Podcast. Thank you all for listening. Have yourselves a great day, and we'll talk to you later. Bye-bye. Welsh History Podcast is a member of the Evergreen Podcast Network. To find more information on them, you can do so at evergreenpodcast.com. Thanks for listening.